During medical school, I enjoyed learning about embryology. I was fascinated by how a single cell can become a perfect human being, and that fascinated the biology of it, how quickly things can transform into a complete balance of a life. And there also I learned about fetal anomalies, what can go wrong, and that made me pursue a fetal medicine as my career. During my residency, I came up with a question of as simple as, how do we diagnose preeclampsia? Does using urine protein levels accurate? And that actually led to a change in practice all over the world. From there, I took that to fetal medicine, understanding why complications happen after fetal surgery. When I see these patients every day, giving them any bit of hope and making any little change in the trajectory of a life is yet to begin. And I do strongly believe that fetal life gives a very narrow window of opportunity where a little investment goes a long way. We are looking at ambulation. At 1 year, can they stand and creep up on a sofa? At 30 months, can they walk independently? Do they need walkers? Do they need additional prosthesis in the body to walk? And then key for us is, as they get older, into 5, 6 years of age, can they maintain that walking? And those are our major things that we're focused on, while also focusing, looking at whether they need a surgery for releasing the scar in the spinal cord. And we also looking globally, does it help the child cognitive development? Because in spite of in utero repair, the major study showed that their cognitive difference is not much different if they had a surgery after birth. And both babies, before or after, they're a little lower than our normal children. So we believe that the early ambulation, maintaining the ambulation and reducing the consequences of it could improve the cognition. So we are assessing that through multiple disciplines with UTHealth and looking at a global development of the child. Most important is, spreading the word of what we do here and reaching as many patients as possible. Any support at any level would help to advance the field, not only in Spina Bifida, but all other fetal conditions that we manage. Any help helps. My primary interest, and it remains still the same, is actually how to prolong pregnancy after fetal surgery. To date, I don't have an answer how to fix it, but I do have made a major inroads into understanding why it happens. I think we are very close to finding some solutions that might change that outcome.